You know, in today's day and age, ADHD is continuing to be one of the most misunderstood and most abused things out there, being utilized as one of the strongest tools to abuse and harass young men and boys throughout education and life in general, taking traits that they have that are perfectly typical and pathologizing them. It's a concept I talk about a lot over on the show Touch Grass, hosted by my good friend Theo Snodgrass, which is pathologization of the norm, basically taking normal and prototypical behavior and marking it as being something that is severe and something that is abnormal, punishing this behavior that is completely in line with how people should act. Effectively, with the ADHD model, one of the ways this is shown is when somebody is fidgeting. You know, people with ADHD, they don't like to sit still. And they want to fidget, they want to play with their hands and whatnot. And how this is done is that I said, well, this person can't sit still, so obviously there must be something that needs to be treated. A completely typical behavior being pathologized. Another one, a kid getting bored while sitting in class. That's normal. You're supposed to find class to be boring. And when they do that, they immediately get punished for it and put on drugs like Ritalin. And the reason I'm mentioning this is recently an expose from Time came out, and oh god, it's terrible. This might be one of the worst articles I've had to read, not because of the quality of writing or anything like that, but because of the malice and the complete and utter intentional misattribution of the information provided. This is supposed to be a massive expose asking the big questions. Have we been thinking about ADHD all wrong? Or have we just been doing it properly? Well, of course, the way they do it is we're saying that we need to double down on ADHD, but offering everything to the contrary while ignoring what they said 2 sentences ago. One of the worst segments of this paper is when they talk about the downsides of ADHD, and I shit you not, what they do is they list a good 5 or 6 severe symptoms of ADHD, and then say there are no side effects except for growth impediment. I'm not even kidding you. So, before we get in further and I break my computer out of frustration, like, subscribe, and let's get into this. Now, that article from Time is aggressively long, so before we get into that, I want to start with this article from Coffee and COVID 2025, frozen Tuesday, April 15th, 2025, in CNC News, written by Jeff Chowders, which does a good job of summarizing the article and a few other events. They talk about Trump's war against Harvard, which hopefully he wins. They talk about a new Alzheimer pill, but they especially talk about this Time magazine report, which is utterly baffling, and realistically, whoever wrote it should be stripped of their integrity. As COVID and Coffee writes, The Time, yesterday it ran its latest long-form multimedia-style expose, which means it's time for the latest limited hangout. The astonishing article was topped by a classic Post question in the dumbfounding headline, have we been thinking about ADHD all wrong? As we begin to dive into the grotesque depth of Time's faux sympathies, keep one question in mind, why now? It has been 25 years since the ADHD industry took off like a SpaceX Dragon rocket with all-male crew. The now common diagnosis and its even more common drug treatment enjoyed no bigger cheerleader and ardent defender than New York Times itself, but after 25 years of federally subsidized pediatric speed, an eye-watering 23% of boys, nearly 1 in 4, are now taking Ritalin or Adderall for their condition. Do you understand how insane that is? If taken out of random, approximately a quarter of all boys are currently being treated for a disorder that doesn't need medical treatment. And let's be very clear, one thing about me is I've lived with ADHD my entire life. I have mixed type and I have adult ADHD. And most importantly, I'm currently in education. I graduated in under a month to get my Bachelor's of Arts in Psychology. In a minor in communications, cognitive sciences, and philosophy. ADHD is one of the most important things to me, and so I'm going to get very heated in discussing this paper. And the most important thing is, when it comes to the diagnosis and treatment and over-exaggerated medicalization of ADHD, what have we accomplished? Jack all. As the article puts it, they've cured nothing. Unsurprisingly, by 2022, 18 million 30-plus-year-olds were also hooked. Presumably, it's even more now, as we know ADHD diagnoses did increase during COVID and the time after that, as more people were getting unnecessary diagnoses left and right. Ritalin and Adderall are pharmaceutical-grade stimulants from the amphetamine family. Research have known since the early 2000s that both drugs have horrifying side effects. They stunt kids' growth. Children who took Ritalin for an extended period, the Times reported, perhaps for the first time, grew less that quickly than non-medicated children did. At the end of a 36-month study, patients who had consistently taken stimulant medications were, on average, more than an inch shorter than the ones who had never received medication. In just 36 months. That's all. Now, I remember correctly, I could be mistaken, I'm pretty sure I was on ADHD medication for about 5 years. It's also worth mentioning I was diagnosed at an incredibly long age and multiple times. The article continues, I will bet the week's salary that most parents were never told about the Sophie's choice of a trade-off when doctors pushed poppers for classroom boredom and mild behavioral issues. But it was right in front of the fine print, nestled between a cartoon and a coupon for more. I don't think I was told about the lack of height. I don't think I was told that it probably ruined any chance of me being 6 feet. My dad's 6 foot tall, my sister's pretty tall, and somehow I'm the only person in my family who isn't above average in height. Now sure, I could have gone the shit end of the gene pool, but it's also highly likely that the approximate 5 years I spent on stimulant drugs, effectively medicalized meth, very well may be what caused me to be that way. And let's also be clear, this is meth. They are giving children meth. That is what it is. It is great. It is lab grade meth. And that's not all. Last year, a study in the American Journal of Psychiatry found that even a medium strength daily dose of Adderall more than tripled a patient's chance of developing a psychosis or mania. A higher dose rocketed the risk to an astonishing 500%. That is certainly a side effect, wouldn't you say? That's a pretty severe side effect, a 500% increase in mania or psychosis. I don't think people are really grasping the severity of an issue like that. Behavioral issues are what usually lead to people being put on these drugs. And then when you deprave them of the drug, they go even more insane, have even more behavioral problems. Well, who could have guessed? You took away someone's responsibility to control their behavior, and when they are finally depraved of the one thing keeping them in line, they can't control themselves? Who would have thunk that would be the case? Now, prepare to be enraged, and don't worry, if I don't know about you, but I'm already there. The Times blandly reported that, despite decades of study and mountains of prescription amphetamines, the experts still have no theory for how it supposedly works. The only consistent observation seems to be that kids, mostly boys, behavior improves once they start warming of the golden glow of chemical stimulus. Now, the number one theory on how ADHD works that I'm familiar with is basically a lack in dopamine receptors, though I haven't looked at any research recently, so I don't even know if that hypothesis is still accepted or not. Now, despite the risks and lack of any discoverable mechanism of effect, WebMD recently advised parents to problematize their children's ADHD to encourage them to take their medicine. To accept treatment, teens need to feel ADHD as problematic, as a pain in their life that limits and controls them. The medical website sagely advised, in other words, fear. Oh my fuck, you've got to be fucking kidding me. I cannot tell you how enraged this makes me. One of the hardest things, and the funny thing is, the Time article discusses how ADHD makes people feel alone and scared. That is one of the things the Time article discusses, and here they are encouraging it. ADHD doesn't lead to isolation and an inability to relate to others. It is the stigmatization from the industry, from the establishments that make this kind of feeling known. And here's the other thing. ADHD doesn't need to be problematized. It isn't an issue entirely. And most importantly, it isn't an issue that needs to be treated through drugs. It is an issue that must be handled through behavioral encouragement and change. Another WebMD article penned by a Harvard researcher, glad we're going back to Harvard, advised parents to tolerate horrible side effects from the treatment. Parents should know that not all I saw this one in the Time article, and boy is this a terrible defense. Parents should know that not all personality changes sparked by medication are negative, the Harvard professor advised. If a child known for his sense of humor seems less funny on medication, it could be that the medication is properly inhibiting them. Oh yeah, I'm sorry that your kid is a fucking mongoloid now. I'm sorry that he's been zombified. I'm so sorry. But at least he's typical to the rest of his peers now. At least he isn't more creative than them. This isn't so much of an issue of it damaging them, according to them. This is them reducing you to the lowest common denominator. This is Harvard saying that kids should be reduced to the lowest common denominator. No kid left behind, brought to equality by hatchet, axe, and saw. All of the positive traits of your personality, well, it's just problematized, it's pathologized, it's something that needs to be treated. I'm sorry you're no longer funny or creative or intelligent. Be glad that you're now akin to your peers in equally ridiculousness. Or it could be that Harvard is a black hole of a failure that should be immediately shut down, just saying, and you're damn fucking right about that. Perhaps worst of all, the Times suddenly discovered a legion of long-overlooked studies. Of course, suggesting that amphetamine treatment for ADHD doesn't even work. One UPenn study gave a series of cognitive tests to students on Ritalin and compared their scores to students not taking the drugs. The ones who took the medication, the Times reported, didn't do better on any of these tests than the ones who took the placebo, but the ones who took the Adderall believed they had done better. It tricks you into thinking it's working, or at least you feel good about it not working. And here's the reason why. The way that these drugs work, and I can say because I've been on it, is it shuts down your mental faculties. You become, I used the term zombification earlier, and that's because it's what it does. When you're on ADHD medication, you feel like a zombie. You literally lose drive. You cannot do anything because anything you feel like doing, it's like there's a pit in your stomach that's screaming at you to do something, and it's like, I don't want to. I feel bored. I feel sick. I literally would feel sick getting up to do stuff. I couldn't play games. Like, I couldn't play Skyrim because I felt sick by the notion of having to do something. It wasn't that I was inhibited in doing things I shouldn't be doing. It's that I was inhibited in doing anything. And because it's such an extreme attention zap, draining all attention and ability to work on anything else, all I could work on is what I was told to. When I had proper motivation of it's a task that I must do, that was the only time I could really work on anything. So sure, my schoolwork excelled, not because of anything from the drugs, but because there was nowhere else for me to put my attention. I wasn't able to direct my attention elsewhere. My schoolwork improved because I wasn't slacking off. A 2022 Florida study reached a similar conclusion, finding that the Ritalin affected behavior, but not academic performance. Children taking Ritalin worked faster and behaved better in the classroom than those on the placebo group, the Times admitted, but they didn't learn any more than the control group. The researchers' conclusions were stark. Although it has been believed for decades that medication effects on academic student productivity and classroom behavior would translate to improved learning, the scientists wrote dryly, "We found no such translation." And of course not, because here's the thing. The ADHD brain works. It just works faster and differently, and it makes connections quicker. Effectively, the ADHD brain is the hare, and everyone else's brain is the tortoise. It makes the jumps faster. One of the things, earlier they mentioned humor, kids with ADHD, with legitimate ADHD, are funnier because their brains work faster and therefore can make connections quicker. So what you're doing is you're cutting off their ability to make these quick connections, and instead you force them to learn like a normal person, which isn't a better form of learning. Worst of all, a 2023 Australian study gave half the kids Ritalin and tested both groups on something called a knapsack test. It's a computer game in which the kids drag digital items in and out of a knapsack, trying to maximize the content's dollar value, making trade-offs for weight and size. The Ritalin kids did worse than the unmedicated students, even though the drug children looked busier. Although choices didn't make much sense, they kept pulling random items in and out of the backpack, the Times said. To an observer, they appeared to be focused, well-behaved on task, and the paper reported, but in fact, they weren't accomplishing anything of much value. Yes! Have you guys seen the movie Warm Bodies? I watched it over at my aunt's house a few weeks ago. It was okay. It's not a great movie. But one of the things is, you notice that the zombies look like they're doing something. They're walking around, they're pressing buttons, seeing what works, what doesn't. But it's aimless. They don't actually have a purpose to these tasks. It's just an echo of their previous life. And that movie might very well be the best definition of what it's like to be on amphetamines as an ADHD person or as a general person. Because here's the thing. The effects of these drugs also impact neurotypical folks. Those who don't have ADHD, if put on enough Ritalin, will have the exact same impact on their brain as ADHD people have. So these kids, their ability to make neural connections has been severed. Their ability to use their brain effectively has been completely hampered. Also, they can look like they're busier, but in reality, they're spending more time solving a problem that the ADHD brain could have solved in significantly less time. And then, of course, this article goes on to explain another expose from Times, which relates back to Alzheimer's, and how Times Magazine basically admitted to doing the exact same thing with Alzheimer's and their treatment, stigmatizing any kind of thing to the contrary and shaming you for looking into any alternative methods or approach to this kind of treatment. So shout out to Coffee and COVID, because that was a wonderful article that was perfectly well handled. And now we're going to get to the actual time argument. Now don't worry, I covered most of the stuff in that article, so we won't be going through the entire article. And the reason I mention that is this article is ridiculously long to the point of excess. And of course, if you were to listen to it, it would take you an hour and 1 minute. Now, given the fact that I am the ADHD brain that I am, I can quickly skim it, pick out things that mattered. Now, what I find very interesting is the way that they choose their headers. These headers are intentionally, maliciously decided to make it seem like there's nothing wrong and everything is really innocuous. Now here's a paragraph that gets into some of that pathologizing the norm that I mentioned. ADHD has always been a controversial diagnosis. Skeptics argue that many of the classic symptoms of the disorder, fidgeting, losing things, and not following instructions, are simply typical, if annoying, behaviors of childhood. In response, others point to the serious consequences that can result when these symptoms grow more intense, including school failure, social rejection, and serious emotional distress. So here's what they're saying here. Why shouldn't we treat the innocuous stuff when it could lead to the most catastrophic things in the world? Their argument is the same one used against nuclear energy, taking to the nth degree, where you're saying that, well, yeah, some things are completely harmless, but what about the 0.00001 chance that it goes nuclear? That's what they're saying here. They're shaming you for being willing to take a completely normal risk on behavior that is completely normal. Another thing this article spends a long time discussing is the biological argument. Effectively, for a while people were thinking that ADHD is a one and done, you have it or you don't, and there's a clear biological sign. But of course, it doesn't seem like that's the case. After all, the stuff that we know about ADHD is, for instance, it wanes as you age. ADHD diagnoses don't actually carry over. When you hit 18, you have to be re-diagnosed to properly say you have it, as the diagnostic criteria for childhood ADHD and adult ADHD are different. And almost every single investigation into the neurochemistry and the structure of the brain have found very limited and not particularly helpful results. I can't believe I missed this line, skimming, and that's the danger of skimming. In reference to the effects of medicalization, there's a real disconnect between the almost awesome effects on behavior and the minimal effects on academic achievement or attainment. ADHD medication has, according to this author, amazing, almost awesome effects on behavior, despite very little impact on education. What are these amazing behavioral effects that I've already run you through? Becoming a zombie, becoming devoid of your soul. It is effectively like somebody took a cleaver between your mind and your soul and left only the body to rot. Such an amazing impact as having your entire personality strip mined for anything that's useful and not at all bothersome. It's saying that the amazing impacts on behavior are that you become an automaton who does everything the teacher wants. You no longer become a little rowdy in class, you don't need the excess recess time, and you don't need any kind of help whatsoever. And therefore, those are awesome effects on behavior. Get the fuck out of here with this disingenuous bullshit. And you know, I've got a lot of contention with this line here. There's no long-term effect. The only term effect I know of has been the suppression of growth. And you know what, motherfucker? That's a long-term effect. I don't care if you're saying there's none and then there's one, and that's ignoring everything else. What about the psychosis increase? What about all the other problems? Here's the truth of the matter. There is something known as tic-causing ADHDs. Some classifications of ADHD do come with physical, body, and facial tics, or vocal ones even. Not to the extent of Tourette's, but there's still a tic disorder. For those who aren't aware, a tic is an involuntary muscle spasm or behavior that you cannot control. And you know what a consequence of long-term amphetamine and stimulant abuse is? Tics! I have a permanent ticking disorder because of my time spent on ADHD medication. It is something I can't control. I have a few vocal tics that involve breathing weirdly. My face tics. I constantly have to move my ears or my eyebrows or my mouth or my eyes. The amount of times I've caused headaches from muscle strain from moving my ears because I'm ticking there is quite insane. Or other times where I have uncontrolled muscle spasms in my pectorals or my arms or my legs, where I just feel an extreme need to tense up the muscle and then release it. And it causes severe discomfort if I don't tense up the muscle. That is a long-term effect. I would love nothing more than to have not developed these permanent tics, but they're not going away anytime soon now, are they? And in this paragraph, the original MTA study, like the later knapsack problem study and the summer camp study, showed a strong effect of stimulant medication on behavior and next to no impact on academic achievement. Back in the early 2000s, Swanson was troubled by those results, but the bigger issue for him was the fact that even the behavioral benefits under stimulants faded out so completely. He and his colleagues spent much of that decade analyzing and reanalyzing the MTA data, and they kept coming back with the same result. After the first year of treatment, the relative positive effects of Ritalin on behavior started to shrink, and by the end of the third year, they had disappeared altogether. which is an experience that I also had. Throughout my time on ADHD medication, my doses were consistently being raised and my medications consistently being changed as I very quickly adapted to the excessive drugs in my system and shortly grew out of them and was able to return to a somewhat normal level of behavior. So that's another damning indictment on the actual qualifications of medicine, which makes it even more baffling that Time still praises the use of medication. They don't work. They don't work for a long period of time, but people will still prescribe them for long periods of time. And more importantly, the effects of the drugs seem to disappear entirely by the third year. So people who were noticing their ADHD was still bad, so they thought they needed more drugs, but more drugs wasn't going to solve anything because they've completely acclimated to the drugs. Now, you remember that line about how there were no long-term consequences? Of course you do. I've already said it twice. Check out this paragraph inside of this fucking article. Researchers acknowledge that there are other risks inherent in taking prescription stimulants. Amphetamines can be powerfully addictive, and last year's study in the American Journal of Psychiatry found that even a medium-strength daily dose of Adderall more than tripled a patient's likelihood of developing psychosis or mania. A high dose increased the risk by a factor of 5. Still, for most scientists, including Castellanos, Sonag, Bark, and Gabrielli, the positives of medication outweigh the negatives. As Gabrielli put it, I feel the bigger risk is people not getting help who are struggling in everyday life. Yes, so it's better to risk an extreme addiction that if you try to quit, you'll probably die. And it's better to risk mania and psychosis and reduced height and permanent facial tics and heart problems from prolonged stimulant use and yada yada yada. All so that you could have what you could get from a couple of months in therapy. Compared with other psychiatric medications, Gabrielli explained Ritalin and Adderall and the many similar formulations on the market today are relatively safe and effective. They don't help everyone, but in the short term at least, they provide significant symptom control in most of the children who take them. Clinicians generally consider them easy to prescribe, in part because they're usually easy for patients to quit. Unlike antidepressants, for many anti-anxiety medications, they don't linger in the bloodstream for more than a day, which means that even with the extended release versions, they don't require a weaning process. You can just stop taking them at some level. Gabriella told me these stimulants are not far from Red Bull. So a counterpoint to that argument, and I'm legitimately saying this article is being bullshit, it is recommended that anyone with an addiction to Ritalin seek professional help to detox rather than attempt to go cold turkey or do a home detox. In fact, it's such a problem that it is something known as a Ritalin crash. One of the best ways to avoid a crash is by adding a mini dose to the medication they already take. A dose of short-acting ADHD medication can be helpful, shares Dr. Kaufman. This small booster dose helps counteract the rapid drop-off of medication without interfering with bedtime. So what does that say? Well, something they also ignore is ADHD medication only lasts for about 5 or 6 hours, about the length of a school day. And when it wears off, the crash is severe. The behavior that you exhibit once you come off of ADHD medication is effectively a massive rebound in the behaviors they want to exterminate in such a way that it becomes almost unbearable. You can become violent and psychotic when you deal with a Ritalin crash. Now, at least they included this line, because I agree wholeheartedly. After 3 decades of studying stimulants, Swansers differs with many of his colleagues on their value. I like how they put in the many of his colleagues as to show what the popular belief is. I don't agree with people who say that stimulant treatment is good. He told me it's not good. He acknowledged that medication can often produce short-term improvements in children's behavior, but he says there is no long-term effect. The only long-term effect that I know of has been the suppression of growth. If you're honest, you should tell kids that, look, if you're interested in the next week or the next month or even the next year, this is the right treatment for you, but in the long run, you're going to be shorter. How many kids would agree to take medication? Probably none. Now, there's a very small piece of information that I like that they put in there. By them admitting that no kid would willingly take a stimulant treatment if it meant they were not going to grow as tall, that none would take it. What that means is that the way you get a kid to take ADHD medication is to lie to him. What you are saying is the best way to ensure a kid gets on this medication is to not allow them the opportunity to give informed consent. You are denying this kid's right to refuse treatments. You are not allowing them to know what the consequences are. Sounds similar to a few other medically approved of drugs and treatments we know of that if you criticize too hard, you get banned from YouTube for mentioning. Now, what's bizarre is this segment entirely, which is all talking about the impact of ADHD medication. See, these are 3 paragraphs dedicated to really praising ADHD medication. Like this kid refers to it as like you're a horse with blinders on. But then there was this one small paragraph that offsets all of that value. Though he found Ritalin effective, both for baseball and test prep, he didn't like it. Honestly, I pretty much hated taking it, he told me, but I knew I needed it for my SAT. He described for me the daily ups and downs of the medication, which affected not only his mood, but also his appetite. When I take it for studying, it does feel like I'm getting an adrenaline rush. He said, I feel happy. When it peaks, you feel good about yourself. You're studying, you're locked in, but once it wears off, you just feel awful. Yes, because you are slightly overdosing on a dopamine rush. Another player, being John, had said that around my friends I'm usually the most social, but when I'm on it, it feels like my spark is kind of gone. John said, I laugh a lot less, I can't think of anything to say. Life is just less fun. It's not like I'm sad, I'm just not as happy. It flattens things out. It's like that gray filter that some stupid TikTokers will put on something to show that how life looks now that you're an adult. Or, the Twilight movies. How everything's got that really ugly blue haze around it? That's what life on ADHD medication is like. Everything is muted, everything is darker, and nothing is as great. Everything is worse, and your ability to enjoy things is heavily hampered. Just as I said, it's like they're ripping the soul out of your body and mind. And oh my goodness, if this is not the most manipulative statement right here, if I don't have to do any work, then I'm just a completely regular person. They're expecting you to read that and not think much of it. This is a very manipulative article, and this just shows it. You know what the context for this is? Well, somebody had said that they only take Ritalin for when they're actually doing work or academics. And so this is being used to show that if you're not working, then this medication has no side effects. But in reality, what this line is supposed to be saying is that when I'm not working, I'm not on the fucking drug. It's more manipulation to make it look like medical treatment is the best treatment. Now, this one goes back to the WebMD article that was mentioned in the Coffee and COVID article that talked about how we need to stigmatize ADHD and make people problematize it, to make them feel like it's an issue that they have it. Emotionally abuse these poor children, so they're forced to take the medication. And so to express this, they're sharing it just the same. For other teenagers, the negatives of stimulants outweigh the positives, and they lobby their parents to stop taking the medication, or they just quit on their own. Statistically, most adolescents don't stay on stimulants for more than a year. Coincidentally, that's only the effective period. To Swanson, the high quit rate is further evidence that over the long term, the medications just aren't that good. If it's so effective, why do people stop? Yes. The physicians say they stop because they don't know what's good for them. So the parents hear the message, if you don't fill this prescription, you just don't know what's good for your kid. But if you ask the kids themselves, they say it makes me feel bad, or it didn't help me, or it stopped working. Why do you believe? And a significant part of the ADHD establishment does, in fact, promote the message that children and adolescents who resist medication don't know what's good for them, stigmatizing it once more. You encounter this point of view often when you read Attitude magazine, which is owned by the online publisher WebMD. When the headline on one recent read, half of college kids stop taking their ADHD medications, make sure your teen isn't one of them. And the third article by Robert Olivardia, a clinical psychologist who lectured at Harvard Medical School, gave advice to clinicians on how to respond if parents say they're worried the stimulants medication is muting their children's sense of humor. They suggested response, maybe your child was the wrong kind of funny. Parents should know that not all personality changes sparked by medication are negative. Imagine that. You should know that because you're not as funny, that's a good thing. That's a good thing, that you're like everyone else. Olivardia advised, if a child known for his sense of humor seems less funny on medication, it could be that the medication is properly inhibiting them. In other words, it's not that the child is less funny, it's that they are more appropriately funny at the right times. We've already gone over why that's a severe problem. And right here is where I mentioned that earlier, where the snippet was claiming if I don't have to do any work, then I'm just a completely regular person, he said. But once I have to focus on things, then I have to take it or else I won't get any of my stuff done. Notice, this is all about how when he's not in school over summertime, he just doesn't take it. John sensed that his ADHD is situational. Okay, let's get through this because this is a violation of the diagnostic criteria of ADHD. That he has it in some circumstances, but not in others, is a challenge to some psychiatry's long-standing assumptions about the condition. After all, diabetes doesn't go away over summer vacation, but John's intuition is supported by scientific evidence. Increasingly, research suggests that for many people, ADHD might be thought of as a condition they experience, sometimes temporarily, rather than a disorder that they have in some unchanging way. Good fucking lord. Okay. Alright, so part of the requirements to be diagnosed with ADHD is you must have your symptoms in a myriad of situations. It can't just be one situation. I believe the DSM-5 offers two, which is not nearly enough if you ask me, because so many situations are borderline the same. So if he only has problems focusing when in an academic-based setting, then he doesn't have ADHD. He fails the criteria. And here's where the ADHD discussion gets really interesting, because this is what I firmly believe too. I'm not saying it's interesting just because it affirms my biases, but it certainly does. For the young adults in the niche study who were interviewed about their work lives, the transition that helped them overcome their ADHD symptoms often was leaving academic work for something more kinetic. Effectively, what this is saying is a lot of people really struggles with ADHD in academics or in controlled environments, but when they go into an environment of their choosing, their ADHD symptoms seem to poof, go away. Some people citing that when they go to work in a mechanic shop, they no longer have to deal with it. Some people argue that when they're studying hair cutting and doing a beautician school to learn to be a hair cutter, that's when it went away from them. Similarly, when I'm studying ADHD and studying psychology, many of my symptoms seem to fade as I hyperfixate on what I'm reading about. And this is where the discussion of is ADHD a superpower comes from, and it's one that I can thoroughly say it indeed is. ADHD is normal. It is a normal expression of, well, it is an extreme expression of normal behavior. And part of what that entails is that when you are in an environment you're bored in, you're going to be bored. And this really ties back to some of the issues such as the war on boys and men. Were you aware that as kids lose recess, the rates of ADHD-like behaviors seem to increase? Well, it's because boys aren't able to get out their excessive energy. Recess is actually a necessary aspect for academics and young children, especially in young boys, because they have to output their extremely highly pent-up energy, and if they don't get it out, they'll have to get it out through minor expressions such as fidgeting, leg shaking, and stuff like that. Things that they have to burn off the excess energy. And when that's denied, you're fucked. And academics discourages burning off excess energy, as things like recess are denied to more and more kids, and the cutoff for when they're offered is being reduced, and the activities you're allowed to do are being reduced. Is it shocking that as gym classes become easier and as things like tag are discouraged in the playground, that ADHD is on the rise equally? Almost like we're stigmatizing the behaviors that naturally treat the disorder. Here's another interesting thing. I think my brain had probably matured to the point where I had a capacity I didn't have earlier on. Yes, most people grow out of ADHD. It is a very small percentage that won't. Now here's one of the most important lines in this article, and this should be the thesis of the article. I asked Sonika Bark what he might have gained if he grew up in a different time and place. If he was prescribed Ritalin or Adderall at age 8 instead of just being packed off to the remedial class, I don't think I would have gained anything, he said. I think without medication, you learn alternative ways of dealing with stuff. In my particular case, there are a lot of characteristics that have helped me. My mind is constantly churning away, thinking of things. I never relax. The way I motivate myself is to turn everything into a problem and try to solve the problem. I work in a similar way. My brain, I'm not on medication. I made damn sure to get off of it. And when I broke medication, part of the contingent that my mom had with me to do it is I had to try some homeopathic remedies first. I had to completely cut out red 40 from my diet. I had to go gluten-free, or I had to try a few other things that some of them had some effect, but it's hard to tell what was real and what wasn't. And of course, I had a lot of behavioral therapy to help me through it. Now, my therapists were absolutely atrocious. I didn't have a single good one. But the only one who ever said anything that really resonated with me was a social worker who hit on my mom. Yep, he tried to get my mom to go on a date with him while I was in therapy with him, which is a violation of a lot of rules. And I can't remember the advice anymore, which is tragic, but he said something that just clicked. And part of what helps me is just you have to learn to self-motivate. And that's the problem. People with ADHD really suffer with self-motivation when it's something they don't want to do. So you have to create a way for them to want to do it. Such as Sonika making things a problem to be solved, and that motivates him to get off his ass and do things. A huge thing I do to motivate myself is knowing that the hassle of not doing it will eventually be worse than the hassle of doing it. Like I brush my teeth because I know that it is going to be gross if I don't. My mouth will feel weird, I'll taste weird things, and my teeth will develop cavities at a much faster rate. That is what I need to tell myself to motivate myself to brush my teeth. The simple model has always been basically ADHD plus medication equals no ADHD, he says, but that's not true. Medication is not a silver bullet, it never will be. What medication can sometimes do, he believes, is allow families more room to communicate. At its best, he says, medication can provide a window for parents to engage with their kids by moderating children's behavior, at least temporarily, so that family life can become more than just endless fights about overdue homework and lost lunchboxes. If you have a more positive relationship with your child, they're going to have a better outcome. Not for their ADHD, it's probably going to be just much the same, but in terms of dealing with the self-hatred and low self-esteem that often goes along with ADHD. And that's very much true. In my personal opinion, there is a cause for medication. Medication is great for crisis. Unlike antidepressants, you can pop a pill and you'll be good for the next 8 hours. And then once those wear off, you have to deal with the symptoms again. But it's great if you have your SAT coming up or something really important that you just need a one-time hit. I'm okay with crisis medicating or medicating just long enough to get the behavioral therapy kicked off. But this last line, dealing with the self-hatred and low self-esteem that often goes along with ADHD, is a baffling line, one that completely ignores the articles that this author mentioned earlier. The diagnosis can create an identity that enhances prejudice and judgment, which are associated with even greater feelings of isolation, exclusion, and shame. Well, that's just because the ADHD brain is better at making connections. But the bigger thing here is the bottom, that it creates a feeling of isolation, exclusion, and shame. So what's bizarre is an Australian psychologist named Louise Kazda has studied this very question. In 2021 review paper, she and her colleagues found 14 studies in which received an ADHD diagnosis created a sense of empowerment by supporting a sense of legitimacy accompanied by understanding and sympathy, as well as a decreased guilt, blame, and anger. But in 22 other studies, Kazda wrote, a biomedical view of difficulties was shown to be associated with disempowerment by providing an excuse for problems. A decrease in responsibility by all involved can occur, often followed by inaction and stagnation. An additional 14 studies found that the diagnosis increased feelings of stigmatization. The diagnosis can create an identity that enhances prejudice and judgment, Kazda reported, which are associated with even greater feelings of isolation, exclusion, and shame. Okay, so this is going to take a minute to, So remember a few minutes ago, probably 10 minutes ago, when we discussed the articles released from Harvard's Medical Journal and MDA, which encourage that you stigmatize and pathologize your children who don't want to take medication for their ADHD, to tell them that they must, and if you don't take it, you don't know what's good for you, and you don't know what's good for your child. Remember that article? And how it mentioned all those problems? And somehow it's the ADHD's fault. We're putting the chicken before the egg, where we're looking at the world's biggest post hoc I've ever seen. Medication does not reduce the rate of shame and whatnot. It reduces the amount of pressure being put on you. If you refuse, and trust me, I know from personal experience, if you do not take the big pills, then you get bullied, you get shamed, not by your peers, but by your parents, by your teachers, by the institutions. I remember back in 7th grade, I had a teacher's aide applied to me, and she treated me like an infant. It was one of the most degrading experiences of my life. For 2 months, she would follow me around and be like, hey, Arza, let me look at your notebooks. Let me make sure everything's nice and organized. Hey, Arza, this is in the wrong notebook. Do you want me to fix that for you? You want me to fix that for you? And it was the most degrading, infantilizing, and patronizing thing I've ever experienced. That made me feel isolated. My diagnosis never did, and my peers sure as hell never did. Not because of my ADHD anyway. I have never felt badly about my diagnosis, aside from when I was dealing with people like her. And the only reason I ever got free is because she tried that one day when I wasn't feeling particularly well, and I'm not even kidding, I did yell at her. I yelled at her in the middle of class, and I told her to leave me alone. And what exactly did that do? Well, that makes people think I'm a little crazy and a little stir-fry, wouldn't it now? Which would then go back to increasing the issues of exclusion and shame. The shame and exclusion is not something that is tied directly to the disorder, but instead how the institutions treat the disorder. That's the real problem. Now, there's one last point that I forgot to mention, because ADHD, I highlighted, but I didn't find the segment, so I'll just mention it here. There's one other severe problem with the way that we handle ADHD. We don't treat it like an actual disorder, we treat it like an identity trait. You see it everywhere, people, especially women, talking about how proud they are that they have ADHD. Look at me and my victimhood points. I'm a little neuroatypical. I'm a little bit of a spaz, and I fucking hate the label neuroatypical, because it all does is it encourages and praises you for having a dysfunctional mind. That's the sole purpose of that term. It is disingenuous and it is disgusting, and when somebody creates an identity around a disorder, it discourages you from ever treating that disorder. ADHD gets worse once you get it diagnosed, not because the symptoms become more clear, but because you have less of an incentive to self-regulate. If And this is one of the biggest things that helped me deal with my ADHD, was understanding that despite my disorder, I am responsible for everything that I do. My behavior, my slacking off, me not doing what I should, I'm still responsible for it, even if I don't want to do it. Even if it's something wrong with the wiring of my brain, it's not an excuse to not do what I have to do. So I'm utterly baffled by this article, because it truly is something malicious, and it is truly something that is evil and foul and should be disavowed, and something that we should realistically stigmatize those who wrote it and probably take away their license to publish any article ever again, because they lack any form of integrity, actively proposing a claim and then offering only evidence to the contrary, so that despite the evidence present, the way that they presented it leads people to think that it affirms them. The abusive and manipulative place of headlines, the way that they discuss the things, the way that they bury a lot of the more negative traits and just wave away the negativity. It's all designed to reaffirm this notion that we must medicalize, treat, stigmatize, and pathologize normal behavior and pump you full of drugs when you're a little bit wacko. And why? Well, the easy answer is because it makes a fuck ton of money, and it makes women's lives easier so they don't have to try as hard when they're teaching. And it makes it so parents don't have to worry about their kids as much, and we can just shove them full of pills and forget about them. It's something that is truly depressing and really needs to be fixed. But that's pretty much all I've got. My throat hurts from talking so long. Let me know in the comments what you guys think about this, and I will see you guys on the next one.